Okay, good evening, Orange County. This is County Executive Steve Neuhaus. You are on either live Tele-Town Hall or Facebook Live or through the county website live. You are sitting here with, as well as the County Executive, the Health Commissioner, Irina Gelman, as well as Commissioner Brendan Casey, Commissioner of Emergency Services. So I'm going to give you some basics of where we are today in our community relating to the coronavirus. Right now, I can report to you that we have 1,782 positive cases in our county. We have a total of 25 deaths. Of the ICU beds, we have a 38% availability rate, but what we're trying to talk about, and you'll see me talk about this daily, is the amount of people that are actually hospitalized in Orange County related to the COVID-19. We have 227 hospitalized today. Of the 227, 140 have tested positive. The other remaining 87 are people under investigation that have shown the symptoms and have been required hospitalization. We have a number of things to talk about tonight. We're going to take your questions. For business owners, tomorrow at 4 p.m., the Orange County IDA will have a live webinar on how you can access and get support from that agency. There's going to be a lot of things out there, so I encourage business owners tomorrow, Thursday, April 2nd at 4 p.m. to log in to listen to that, as well as Friday, April 3rd, the Orange County Chamber of Commerce and Orange County Economic Development are going to be having another webinar at 2 p.m., which is going to go over all the different federal stimulus, as well as the things that the IDA has to offer. In addition, they'll also talk about unemployment. So with that, we're going to cut to the chase. We're going to go to Dr. Gelman. You want to give an update?
Thank you, County Executive Neuhaus. As you've mentioned, we currently have 1,782 COVID-19 positive cases in Orange County with 25 deaths. 227 individuals remain hospitalized with 140 testing positive. I did want to thank our tireless Orange County Department of Health team, as well as the team at Emergency Management Services for working what is now proven to be a marathon for weeks at a time. So we greatly appreciate all of their help, as well as all of our departments and numerous volunteers. I will say clinical trials are underway for vaccines. There are currently a number of medications, including hydroxychloroquine and remdesivir, which is an antiviral, that are in clinical trial phases. The rapid testing is becoming slowly available, possibly as early as next week. There are numerous different companies from the West Coast, mostly from California and Texas. There are 30-minute rapid tests, 45-minute rapid tests, and what those entail are point-of-care testing that would be done in a clinician's office, where the test results would be available within 30 or 45 minutes. In terms of CDC clearance guidelines, as well as CDC cleaning guidelines, and a number of other updates from the New York State Department of Health, from the CDC, all of those documents and updates are available on our Orange County Department of Health website. Just click on the COVID-19 tab, and a lot of useful information there. In general, I'd like to emphasize the fact that in experiencing COVID-19, for a lot of individuals, they describe a flu-like illness with all the sequelae of such. 80% of cases will present with mild symptomatology. 80% of cases will resolve on their own, with 16% of cases that will go on to develop complications, and that reported possible 2 to 3% fatality rate. So thus far, the data has been fairly consistent on that end. Clearly, we do have broad community-acquired transmission. So at this point, pretty much you are to assume that any individual is a presumptive COVID-19 positive individual who's displaying symptoms and appears to be symptomatic. In terms of plans, we've received a lot of questions in terms of just general planning. We are adhering to all of our standardized plans. These have been in place for decades and have been updated to include COVID-19. Some of the plans are pandemic influenza, mass fatality, continuity of operations, emergency response, and that's coupled with our point of dispensing drills that happen every year for public health for 60 plus reportable communicable diseases. Thank you.
Thank you, Doctor. Commissioner Brendan Casey.
So I'll give you some good news. We are finally on the state's radar. They've been sending us stuff in dribs and drabs, but in the last 24 to 36 hours, we've gotten a large supply drop. Came in late last night. I know we had vents sent down from the state, which are out in the hospitals right now. The state has put together a task force. They're going to be sending some additional troopers to partner up with the DA and Sheriff's Office, some local municipalities, to enforce that social distancing in some of our hot spots, like Town of Palm, Newburgh, where we had to close playgrounds in some of these areas. It's not just KJ, it's not just Palm. We are having issues with people coming out and getting involved in mass gatherings, and we can't do that at this point. No one knows better than us how difficult this has been. We have worked every day probably for 30 or 40 days. We're grinding, and I know everybody out there is suffering. We got to get through it. We probably got 2 more weeks of bad things here, and hopefully we'll all get through here. But, we're starting to get some help from the state, so that's good.
Thank you, Commissioner Casey. Okay, folks, so now we're going to take your questions. Post them on Facebook. Also, you could do it with your Tele-Town Hall if you're listening on your telephone. So if you're just joining us right now, I'm County Executive Steve Neuhaus. We have Commissioner of Emergency Services, Brendan Casey, and of course our Health Commissioner, Dr. Irina Gelman. We're handling or answering your questions about the coronavirus. So the first one is, how long will schools be closed? So schools are closed until April 15th at this present time. That decision is made by the governor at this point, and until we start seeing these cases go down, I can expect, or I can venture to guess that the schools are going to continue to be closed. The next question, if I am in a vulnerable age population for COVID-19, how do I go to doctor's appointments, Dr. Gelman? So
that's a frequently asked question, and the best means right now remains telehealth. If at all possible, please contact your provider via phone or remotely via remote access platform. Currently, the single most effective means of protecting yourself and others remains staying at home. So if you're able to utilize those remote access platforms, that's definitely the best way to go.
Can you catch COVID-19 twice?
So again, a lot remains unknown, and we're looking to data from China and globally from countries that have experienced this early on, Australia, others. There are anecdotal accounts. It has not been broadly noted in terms of reinfection rates. However, there is a potential for seasonality because any novel virus can always morph and mutate, and you can have multiple other strains. But currently, there is nothing noted in literature to provide for reinfection or separate strains.
A common question we get is, are hospital overflows from New York City coming to Orange County? Now, with Governor Cuomo has had some vast powers and has passed a number of different broad-ranging laws and authorities under his jurisdiction as a governor. We believe, because we have so many cases in Orange County, that the overflow from New York City will probably be up higher from us. But to answer that question, anything is possible with Governor Cuomo. He could order that, so that would be his jurisdiction. When will a map be updated? It should be momentarily, in the next day tops. What Dr. Gelman mentioned earlier is we don't want people to get fixated on how many are in your town. We had people ask a couple Facebook questions, are there any cases in Chester or Blooming Grove? There are. So whether there's a lot in certain areas like here's Joel or some of the cities or some of the big population towns, that is irrelevant. You need to consider that anybody you come in contact with has it, because a lot of the people that we're seeing, firefighters, cops, healthcare workers, and run-of-the-mill people, have dealt with just people that they just interact with on a regular basis, not from those communities, not from those cities, or not even going into those communities, still contracting it. So if you want to protect yourself and your family, stay home and avoid contacting with any people. Stick with that social distancing of 6 feet. Do our hospitals have enough supplies? This is the thing that we do, Commissioner Casey and Commissioner Gelman. We're giving supplies to hospitals when they need it. They also have their own supply chains. Either one of you want to chime in?
I would just say that nobody is getting everything they asked for. We prioritize here all the emergency supplies that are coming into Orange County that we're either purchasing, being donated, or coming through New York Responds, come to the EOC. The hospitals and nursing homes have their own supply chains. We are there to back them up. So we're making sure that people get some equipment out there. But again, nobody is getting everything that they asked for.
Another good question. What are you guys doing about KJ, Kirs Joel? So Kirs Joel remains a community that's very high density. They are about 20% plus or minus of all the positive cases we have in Orange County, but that doesn't cover the entire county. Like I said earlier, all the communities around the county have had positive cases. So what in particular for high density communities like Kirs Joel, or maybe areas where people are either can or are ignoring the social distancing, gathering still? So as Commissioner Casey mentioned, the governor announced today that they're going to have a task force in every county made up of their law enforcement, including our district attorney, the sheriff's office, the state police in Orange County in particular, local police, and they're going to go to these hotspots in Orange County, as they are called, to start investigating and to break up these cases. The DA has texted me since we started this Tele-Town hall and said he's going to prosecute people that are not listening to the social distancing, that are continuing to having these gatherings and not complying with the governor's order.
I'll also say that I was the state police zone commander down in Monroe. I did 30 years to state police, spent a lot of time in Monroe from trooper, sergeant to captain, dealt with KJ extensively. The leadership down there is behind this. They've had religious scholars reach out to the various rabbis and say, look, public health trumps this. So they are putting that message out. They want help. We've sent health department personnel with the state police in there. Just yesterday, was it, Doc? Yesterday?
Yes. Mm-hmm.
They were down there doing knock and talks on some of these synagogues and shuls that were not being responsible. The county exec drove through there today. It appears that it was all quiet. There was no large groups. So we're doing everything we can to get the word out. The state realizes this could be a problem coming into the holidays. So we're going to stay on it, but we're all in this together, and we're going to do everything we can to reinforce our message down there in Palm and Newburgh and some of the other municipalities that have had some social distancing problems.
And regardless of where they are in Orange County, whether it's Kirs Joel, Monroe, Chester, Middletown, you name it, if people are having gatherings or doing things that you believe are in violation of law, call your officials, call us, take a picture, send it to your police department, and they will be followed up on. And keep moving on here, Dr. Gelman. This is something that we all would love to know, the million-dollar question. How long do you anticipate this lasting?
So we've been discussing this. It's highly dependent on the epidemiological curve. We're still in the incline phases, so we haven't sort of plateaued out. But as we originally estimated this out to be anywhere from 4 to 6 weeks, that estimate still stands for the really kind of worst of it, for the brunt of it.
Okay, so here's some quick ones. Can county give firefighters and law enforcement gear for protecting themselves? Of course, we're doing that. So in this emergency operations center, maybe one day in the next week or so, we'll give you a walkthrough of where people are, what they're doing. We have a police coordinator, fire coordinator, and EMS. And their sole responsibilities is to be that conduit for the local police department. If you're the police coordinator, fire for all the fire departments. We have a number of them in Orange County, as well as EMS. So when they start getting low, we replenish them. Like Commissioner Casey said, supplies are coming in, but unless you're running very, very low, they still are very sparse, so we have to give them out very conservatively. The next question is, will supermarkets run out of food? At this time, no. They're continuing to get supplies, but like many other businesses, including county government, you're starting to get individuals that are calling out sick because they're actually becoming positive or starting to show symptoms of this virus. So that supply line for the supermarkets is being impacted. That's why today, earlier, I said they are about 48 hours behind. Dr. Gelman, is COVID-19 airborne?
No. So currently, there are no studies to demonstrate that COVID-19 is airborne. It is still droplet precaution. I believe there is one website that currently indicates this for airborne precaution. Majority of evidence-based publications still dictate droplet precaution.
Another great question, Dr. Gelman. Yesterday we had somebody, in the last few days, we had somebody in their 40s die. And here's a continued question. Are older and younger people being hospitalized for this virus in Orange County?
There are different age demographics. We have not had pediatric cases just as yet. However, I will say anyone is susceptible to this. Anyone can be a vector. But recalling what we've started with, the 80% of cases that will present with mild symptoms that will resolve, typically are the younger population. So that 16% complication rate is predominantly for seniors or individuals with comorbidities and pre-existing conditions. So those susceptible and vulnerable populations. And the 2 to 3% fatality rate tends to be overwhelmingly those susceptible and vulnerable populations. That's not to say that you cannot succumb to this, but generally speaking, that is not the case.
Okay, another question. How can we prevent hoarding? Most supermarkets have already put restrictions on the amount you can take out. If their local stores are not being able to handle that, they have been in contact with local law enforcement. But I have to say, so far, we have not heard any cases where the law enforcement had to come in. Commissioner Casey, right?
Yeah, I mean, I think the stores are doing a decent job with it. It's a lot of it was panic buying. I still don't understand the toilet paper issue. But generally, food and the supply lines are fine. People just have to understand that it's coming on a regular basis. And, you know, when you do stuff like that, you hurt our most vulnerable people. I mean, the elderly, people on fixed incomes, they can't buy, 50 rolls of toilet paper. They get their 4 rolls, and if all that's gone, they're really in a bad spot. So, again, a lot of this is we're in it together. We'll get through it. Just have some compassion out there. Understand that society has to work together on issues like this. And for the most part, people have been great.
And this is a good time to just talk about, if you want to help, we can use you. If you want to volunteer and you're in good shape and you want to deliver meals, we can use you. We have a 1-800 number. It's posted on our site. Call and volunteer yourself. If you don't, this is a great opportunity for you to call your neighbor, call your family, check on them on a daily basis. What can I do for you? Do you need something? We have the ability in county government now. We have now grown our sea legs since this thing has started. We can get you prescription drugs. We can get you food to your houses. We can help the businesses as best we can to try to navigate through all these new relief things that are coming. So there's a lot of stuff for everybody to do and show our best. So let's go back to the questions. Are we still testing, Dr. Gelman?
Yes, so that's a great question. We are still testing. However, there is this preponderance with more and more cases that we are seeing of that presumptive positive that I mentioned earlier on, where at one point we will move away from that generalized broader testing. There will still be testing conducted, hopefully that point of care that I mentioned with rapid testing in provider offices. But generally speaking, if you're exhibiting COVID-like symptoms, you are to assume that it is COVID and take necessary actions. There are no pharmaceutical interventions, so you would treat this as you would a flu-like illness. You would stay home, self-isolate, and 80% of cases will resolve.
Yeah, you have to be careful with the numbers on when we talk about how many tests we've done, how many positives we have. The hospitals and most of the healthcare providers are really looking at people that have all the clinical signs of this COVID. So when they test them, they should have a high degree of positives because they've gone through all of these questions and testing, and they believe that this person is really either has this or flu or something along those lines. So don't get hung up on we've done 5,000 tests, we have 1,700 positives. That's not an important number. It's really it should be very high positives because the healthcare workers are going through all of those steps they have to do before they say, you know what, let's find out exactly what this guy has. Most people are going to feel a little ill and they'll stay home and they probably won't get tested. So that goes to the community spread where everybody wants to map, oh, I have 100 in my town, I have 200 in my town. Fact of the matter is, it's widespread out there. A lot of people have it. They don't know they have it, or they're just dealing with some mild symptoms, and they're going about their day. So don't get too hung up on the numbers. Main thing is stay home, social distance, let this thing run its course, and hopefully we'll be out of this in a couple weeks.
Okay, Doc Elman, this individual says that they tested positive. Do I need a second opinion to show that I am over it? When can I end my quarantine?
No, and that's a perfect question. Initially, there were different CDC guidelines for clearance, and we have posted the updated CDC guidance for clearance. Currently, that guidance dictates that 7 days from onset of symptoms and 3 days completely clear of any fever or any symptoms associated with it. So that could be a total of 7 days, or it could be a total of 10 days, depending on when you were last febrile or you exhibited your last symptoms.
This is a very good question. How can landlords survive without rent? So that's a tough question. I would ask you to individually call Bill Fioravanti from our Economic Development Office. I know that many of the lenders have stopped or suspended mortgage payments, so I know the landlords have to pay for their mortgages. They also have to pay for their expenses. So there's got to be relief on your end as well, not just to people that are living or businesses that are renting from you, but as their rent gets put on a pause for up to 90 days now, I believe that the landlords should also have the mechanism of having 90 days to pay for their utilities and their mortgages, but that has to be codified. So I would ask any renters out there, landlords, to make sure you clarify that with our Economic Development Office. Great question. Dr. Gelman, can you get long-term lung damage from COVID-19?
So that's another great question that is typically asked. As I've mentioned, 80% of cases will present with mild symptoms and clear. Those 16% rate of complications, depending on the existing comorbidities, depending on what the actual complication is, if you develop pneumonia, if you develop scarring or other respiratory distress complications, there is the potential of developing long-term outcomes from having COVID-19. But that's not unlike any other illness where you are to develop complications. So this is not just specific to COVID-19.
What if I can't afford my mortgage or utilities? Again, I mentioned that a little bit before. You're not getting your power or your cable turned off. Why is cable important? Because a lot of people now become homeschoolers. You need all these different resources. Obviously, the other utilities, the power, the gas, they're not going to be shut off. So again, this is until unemployment checks come in and we get through this, everybody's trying to team up together. That's why we're giving food out to anybody, any family, any individual, regardless of your income, regardless of your problem. If you're worried about this and you need food delivered, we can add you to our existing programs. Has anybody recovered from this in Orange County, Dr. Gelman?
Yes, so many people have recovered, and as Commissioner Casey clearly pointed out, that a lot of the numbers as they're coming in, it's really important not to hone in on just the numbers alone, because especially with the map and with concise numbers, those numbers are really reflective of those individuals that tested positive for COVID-19 that are currently on mandatory isolation. So by virtue of being isolated within their home, there is absolutely no exposure to the public and no public threat that those individuals pose. So what we really have to concern ourselves with are the remaining individuals within those municipalities and the remaining individuals within the community, because that vector for propagation of disease truly lies within the remainder of the population, that if they're not adhering to social distancing and if they're not remaining within their homes, that's where you're seeing the rate of propagation, not with the individuals that have been confirmed positive, which is reflective on the map.
Do any medications or vaccines help, Dr. Gelman?
So with medications, and this is a frequently asked question, I know with hydroxychloroquine, there's this misconception of FDA approval or a broader approval for use. This is not an approved treatment. FDA has approved emergency off-label use of hydroxychloroquine. It is currently a part of a clinical trial. We need clinical trials to determine efficacy in use. So to purport it as a cure or a treatment, it's very early to really be able to assert that. As with any medication that you're taking will clear either through your liver or your kidneys. So there's an associated toxicity with any medication. So to use it prophylactically, whether it's this medication or remdesivir or anything else that's been a purported cure, it's very, very early to establish efficacy. Typically, when the medications are used is with a cohort of patients that are exhibiting critical symptoms. They are hospitalized. They have complications such as atypical pneumonia or any other of the respiratory distress complications that we've mentioned. And it really is a last resort measure, but to purport it as a cure or a treatment, it's very, very early on. And there are reports of increases of calls to the Poison Control Center of individuals utilizing this via prophylactic means, or individuals using this without the prescription of a physician. So it really is up to the clinical opinion of the provider, and this would be typically used in that 16% that will go on to develop complications and are hospitalized.
Okay, giving Dr. Gelman a break. Commissioner Casey, what can be done for enforcement? A lot of questions coming in. How is that going to work?
Yeah, I know the district attorney, they form these task forces. They are going to go and they're going to make a decision on what the charge is going to be. There's a penal law charge that fits. There's some violations of the executive law that fit. There are some health law violations that are pretty heavy fines. So a decision is going to be made by the district attorney, and they're going to put some paper on some people. If you are not cooperating at this point, you are going to get a visit. You've already gotten, the health department, state police were doing knock and talks the other day saying, look, you got to stop this, break it up right now. Next time we come back, it's going to be enforcement time. So people have been put on notice. There's going to be enforcement done. Please don't put the police in that position. They have enough going on. You know, we had the Newburgh situation the other night. This is not the time, folks. So please cooperate with your local officials. Let's get through it, and we can hash everything out later.
Okay, another question. Will parks be open for fishing? Yes. All the parks, for the most part, in Orange County are open, our county-run parks. But we have the caveat that if people start abusing the social distancing, we are going to shut them down. New York City, I think the governor announced today that they're shutting the playgrounds down there. A number of them in Orange County have done that. So if you live in a certain community, make sure you check your local rules. But again, basketball hoops, they've taken those down because people just did not comply. It's that critical. So either comply with the local rules on there. Same thing with our dog park. I think we're allowed to have 50 people showed up at once. So if that continues to happen, we're going to be forced to shut them down. Doc, should people be wearing masks?
So currently, masks are not recommended for general use, and the general guidelines are, as I described earlier, if you're wearing those masks, whether they're surgical or N95 masks, N95 masks have to be fit tested. They have to properly fit in order to work, and they work almost as a filtration device. Regular surgical masks will not protect you from those droplets. The particles are small enough to pass through, unlike the N95 filtration masks. So general public should not wear masks unless they are symptomatic, and it is to protect others from the droplet precautions which we've mentioned. And the main reason for the general public not wearing masks is because of the actual donning and doffing and the actual process that it entails. The general public, when they do wear masks throughout the day, it may become contaminated. If you're touching it, adjusting it throughout the day, if it's not fit properly, it gives you a false sense of security, but more importantly, it can get contaminated. And if you are touching the contaminated surface and then you are to scratch your eye, scratch your nose, adjust the masks, and inoculate your nose, your mouth, your eyes, it really defeats defeats the entire purpose and offers absolutely no protection.
Doc, take a deep breath, get a sip of water. We have like 5 lined up for you. Will it ever get easier to get tested? Where can I get tested?
Yes, so as I've mentioned in the beginning, and that's a great question, we are moving away from that entire concept of testing. If you're exhibiting COVID-like symptoms, you are to proceed as if you have COVID-19, meaning isolate in your home, treat it as you would any other flu-like symptoms. Unless you are in critical condition, you're experiencing more urgent symptoms, at that point contact your medical provider. Of course, if it's an emergency, I urge you to call 911 as I would every single time within an emergency, and they are well equipped to deal with that. But in general, the testing portion of this, the confirmatory portion, the only time you would be tested if it pertains to critical condition and when you are hospitalized. So point of care testing is hopefully going to become available where clinicians would utilize their own discretion and their clinical judgment to test. But in general, just assume if you are exhibiting COVID-like symptoms, proceed as if you have it.
Okay, as I'm doing this, I know the state budget is being adopted or considered, so I'm getting crazy text messages, but everybody's working hard to try to help us out here. So, Doc, continuing with you, are those with high blood pressure at higher risk?
Yes, so we discussed this on our last town hall meeting. It seems to a lot of the evidence-based data seems to dictate that hypertension tends to top the charts as one of the complications. One of the comorbidities that is responsible for the higher rate of complications associated with it. But a lot of the studies that are coming out now actually indicate that some of the medications, so some of the antihypertensive medications that are used may be responsible for that because of the pathway that they utilize. Specifically, we're looking into ACE inhibitors and ARBs, which are angiotensin receptor blockers, because they tend to have that similar affinity for the respiratory tract. So yes, hypertension seems to top the charts, which is counterintuitive somewhat.
Okay, I get this question a lot from employees. They're saying that they're being put into what they believe is an unsafe work environment. That is the New York State Department of Employment. You should contact them. People are saying they're having a hard time getting through. I get it, but I would not give up on it. Now, going to the flip side of that, the unemployment office, people trying to file for unemployment, we've heard upwards of 3.5 hours now today to wait. So I asked you, again, not a county-run thing, but I can understand that the state is being overwhelmed. And again, if you have been recently unemployed, your date of when you start getting the benefits, you'll get a check in a week from when you file, but they will start on the day that you were laid off. So if you were laid off 2 weeks ago and you haven't been able to get in, don't panic, don't worry about it. Just be patient, try to get through the line for unemployment. They'll put you on there and you'll be okay. How do I know the virus is out of my body? Doc Elman.
So you have to, as I mentioned, there are CDC criteria for clearance post-COVID-19 infection. I urge you to go to our website. It's regularly updated. But currently, if you remain 3 days post your last symptom and 7 days after the first onset of symptoms, that is the current CDC clearance criteria used.
Okay. Doc, do people who die typically have previous health issues?
Yes, so overwhelmingly, as we've mentioned, these tend to be older individuals, advanced aged individuals with pre-existing medical conditions, yes.
Okay, this one, Brendan, I'm going to bring you out of the, as a relief pitcher here. How can we enforce families not going to or how can we enforce entire families not going to grocery stores? Mike, you want to explain that question a little bit better? How do we?
I think it might be families are going to grocery stores and it's probably breaking
The rule?
Yeah, I mean, look, you all have to recognize that you have to give that 6 foot distance between people. You know, whether you're family or you're in Home Depot or ShopRite, the food stores have to stay open. but people have to be cognizant of, have some situational awareness of where people are around you. And, listen, know where you're walking. Pay attention to what's going on. I mean, I don't know what else to tell you. If you're not paying attention and you don't care, that's a bad place to be right now. We rely on the public. We used to say in policing that we police because the public consents to be policed. You can't live in a situation where we have to have a cop walk next to every person. It's just not going to work. So we all agree, the health care officials, the elected officials, everybody agrees that it's a good idea to maintain that 6-foot space at least. So that's it. You got to do it.
Okay, we're getting a lot of questions about maps. Doc Elman is putting a nice map together. It's going to have all sorts of stuff on it, except at the end of the day, we're trying to emphasize to everybody, you have to assume everybody has it. This is something that's going to impact you, your family, your loved ones, your parents, people that are elderly, people that are not elderly, people with pre-existing conditions, people without pre-existing conditions. This is a universal request across this country. So you'll get a map. The numbers will be higher than they were a few days ago when we released the first one, but it's going to tell you the same information. It's spread out throughout the county, so that'll be happening. Are tests being done for those with antibodies for the virus, Dr. Gilman?
Yes, so that's a great question, and we brought this up in the beginning. There are currently, there's research underway for titer testing. So you do have some titer tests for other diseases. Currently, those tests for circulating immunity are not yet available, but they are in the works.
Okay, Dr. Gelman, can nurses, I'm working 2 phones and 2 computers. Can nurses who come into contact with someone who is sick get their family sick?
So this is a great question, and this is something that we address almost on a daily basis. Anytime you come into in contact with a COVID-positive individual, there is that risk of transmission. Clearly, the risk is higher for healthcare workers and frontline first responders. But anytime you're coming into contact with a COVID-19 positive individual, just be vigilant, watch out for any type of symptoms. And when I say that, that's with the caveat that it could be mild symptomatology. It could just be the headache. It doesn't necessarily have to be all 3 of the predominant symptoms. It really can just be very mild symptomatology. But once you become symptomatic, that is when you're really suspecting COVID-19, and when you do have a high index of suspicion for COVID-19, that's when you are contagious and you can pass it on to others. Just being exposed to a COVID-19 individual does not automatically make you contagious.
Okay, I put a video on about 2 or 3 days ago from a guy from Rockland County, a guy that's doing some work throughout the region on trying to get 17 expanded to 3 lanes. Mike Lawler, he talks about how he woke up one day with a fever, went to his doctor's office. Doctor told him to go get a test. For 8 days it took for him to get a test results back. And in that 8-day period, he had a high fever. He details the symptoms he had. So that's going into the next question for Dr. Gelman. How long does it take for the test results to get back?
So it really is highly dependent on the lab. This could be tested at Wadsworth, the New York State lab, or these could be test results coming back from commercial labs. So depending on the labs and whether the labs are sending it out to other labs, it can take anywhere from 48 hours to all the way up to 6 and 7 days. So it can take quite a while to receive results. But I will say, in the interim, if you did suspect that you may have possibly come in contact with a COVID-19 positive individual, or you're exhibiting symptoms consistent with COVID-19, if you went out and you actually got tested, please consider self-isolating, self-quarantining while you are waiting for your results, while those results are pending.
Okay, Commissioner Casey and Commissioner Gelman, how are we doing with medical supplies? Do we have enough?
I'll start with that. We always, we have orders in at various sources, like I said, through private companies, Amazon, through New York Responds, which is New York State's ability to move resources around the state. So nobody is getting for everything that they asked for. but we are making sure that that PPE, that crucial PPE, is out where it needs to be, and kind of educating not really the medical community, mostly first responders, on proper use, when it should be used, conserving it, and making sure that we have some rather than none. So that's the key for us here when we start distributing. We have to track, and we're not, we're giving it to private nursing homes, hospitals, police departments. We are not discriminating against anybody, whether you're public, private. If you are on the front lines of this, we're making sure that you have, we have face shields now, we have N95s, we have surgicals, gowns. Everybody wants more, and it's our job to make sure that we get some out and try to keep them supplies the best we can.
And one other question, and Doctor, just so we stay on this, people are talking about ventilators and all this other stuff. You also have to limit, you have a limited staff. One of the hospitals we talked to yesterday said, look, you give me 100 ventilators, I still have only a certain amount of ICU doctors and nurses. So all those things have to come in together when you start putting together how you care for people. Dr. Gelman?
Absolutely. So all of these component parts have to come together. As Commissioner Casey mentioned, we do prioritize PPE needs for first responders, healthcare workers, nursing staff, so everyone really on the front lines combating this. And in terms of ICU beds and intubation supplies and ventilators and so on and so forth, absolutely they have to come with adequate medical staff.
Okay. Is there a waiting period for unemployment? Not really. That's been waived. So as soon as you register, you should be able to get a check within a week. So, like I said earlier, it is a waiting period to get online because they're being overwhelmed. I think over 15,000 people have now registered in New York State on this, or 100,000 last week. I think they're at 150,000 brand new people just in the last week that have gone on unemployment. So be patient. You're going to have to sit on hold. Keep that phone charger on. I hate to say that, but that's happened to people. Their phones ran out of battery. So be patient with that. What if I don't have medical insurance? Will I have to pay for COVID-19? No. But doctor, you want to expand on that? We have a lot of people on Medicaid. We have a lot of people being laid off. And if you do not have health benefits, you will be picked up by Medicaid, which is a pretty quick, it's probably just as, it's quicker than unemployment, I will tell you that. But Dr. Gelman, you want to comment?
So that's absolutely right, County Executive Neuhaus. And also, I will say we have a number of federally qualified health centers within the community that are available to treat everyone, to make sure that everyone within our community receives the proper care.
Okay, Dr. Gelman, does Lysol and other types of sprays help?
Yes, so any type of disinfectant will help. Coronavirus being an enveloped virus, that envelope actually helps us. That envelope, which is a lipid layer, really dries it out with any type of disinfectant and the typical means of decontamination that we can use. But specific guidelines for workplaces and kind of frequently used hard surfaces, we do have that CDC guidance available online for your reference.
Okay, are there multiple versions of the virus?
So yes, there are multiple versions of the virus, and you may see this in literature referred to sort of generations of the virus replicating within any given subset of a community. But in terms of morphology, the mutation, the potential for mutation and the potential for morphing is kind of a different situation. So it's a different permeation of the same virus, but what we worry about is that previous question of having reinfection with a potentially different strain of the same coronavirus. That's what we really worry about, something similar to influenza, which could be type A, type B, so you can have multiple strains and that potential for reinfection. That's what we really worry about. But the different permeations within the same community do happen.
Okay, if you're just joining us or you came in late, you're on a live Tele-Town Hall with County Executive Steve Neuhaus, with Commissioner Irina Gelman, our Health Commissioner for Orange County, as well as our Commissioner of Emergency Management, Brendan Casey, giving you a basis of where we are with the coronavirus in our community. We do have, for the people that are unemployed or people or businesses that have been impacted, tomorrow for the businesses at 4 p.m., we are going to have a live feed to the IDA. The IDA, the Orange County Industrial Development Agency, has put together a mechanism to help local businesses. In addition to that, on Friday at 2 p.m., Friday, April 3rd, 2 p.m., the Orange County Chamber of Commerce and the county government are going to put together everything we know from the federal stimulus that was just passed a few days ago to the IDA, all those benefits, as well as unemployment information for individuals out there looking for help. So we're going to continue to give you that information. We are going to take a few more questions. What do we do when hospitals in New York City are full? That question keeps coming up. The governor has indicated that he has the right and the authority to commandeer or use available hospital beds upstate. I don't know. I don't expect that to happen in Orange County because we are very full now. If you heard my initial reports, we have 1,782 people ill in Orange County positive that have tested positive. We have 227 in our hospitals right now that are either tested positive for the virus or are requiring hospitalization, and that's not counting the many, many hundreds of people that are sick at home, trying to get through this. So I don't think Orange County is going to be one of those places for the relief valve for New York City, but you saw a U.S. Navy hospital ship show up. It's probably one of the first times that you've seen that on our shores, and that's to alleviate non-COVID-19 so the hospitals in New York City can better deal with this. So, Doc, do you want to comment on that? Do you think anything else on that?
Yeah, so, and this is something we've discussed. Obviously, surge capacity it remains an issue, but as you've mentioned so clearly, it's highly unlikely. Is it possible? Anything is possible. Is it probable? Unlikely.
Okay, just so anybody that's listening, whether you're just joining us or you've been on, any of the things we're talking about, go to orangecountygov.com. That's our website. Big thing when you show up, there's a big picture of the COVID virus. You click on that. It'll take you to anywhere you want to know, whether you're an individual or your family, you're concerned, you need help, all that stuff, all that information we're talking about, they're all different links from that. So just go to orangecountygov.com. We'll take a few more questions. Will there be any quarantines? There's basically one now. If you don't need to be at work, you're not an essential employee, you should not be out there. I get it. Some families, you have to go to the supermarket and restock up. No problem. But for the most part, by staying home, you are in a quarantine. What should I do, Dr. Gelman, if you work with someone who has tested positive?
And that's a frequently asked question. So if you work with someone who has tested positive, it is important to know that just by virtue of testing positive does not necessarily indicate that anyone else was exposed. It's only when that individual who tested positive presents to work while symptomatic, the key word being while symptomatic, that can be a cause for concern, and that's when you continue to monitor for symptoms and see if you become symptomatic yourself. But that's just to emphasize the fact that you have to be vigilant and monitor for symptoms, but all of us should be doing that, because with community-acquired transmission, you can really come in contact with a positive individual anywhere, while doing shopping, while returning home from work. So just by virtue of having an individual who tested positive in your work environment does not necessarily mean that you were definitively exposed.
Great question. Will local businesses be okay? They're not going to be okay. We need you to continue to support them. We make it a practice here at the Emergency Services Center to order lunch from different restaurants. Today we ordered from a place in Middletown. I think it's called Mix and Match. Tomorrow we're going to order from an Italian deli in Monroe. Every day we're trying to support that. We also do that individually. Last night I picked up pizza from Brother Bruno's in Chester. So if you want to support your local businesses and you're worried about them being around when we get through this, do what you can to help them now. So will they survive? Yes, but they need your support. They also need the things that we're talking about now, the IDA webinar, as well as the Orange County Chamber of Commerce, the Orange County Government's Mechanism, Tourism, Employment and Training, as well as CDBG, Community Development Block Grant, and of course, Economic Development. Doc, wrapping this up, can you contract COVID-19 virus if you got the flu shot and the pneumonia vaccines this year?
So those two will hopefully protect you from the flu and from the pneumonia, but Coronavirus right now, the novel coronavirus, does not have any vaccines that are readily available to the public to protect you from it. Not yet, but vaccines are in trial and hopefully will be available soon.
Is there any concern over public safety? Of course there is. This is a great opportunity for people to create some additional, headaches for us. We had that in Newburgh. We don't need that. We need local leaders to stop that. And I don't need to be in the city of Newburgh at 2 in the morning like we were last week, where a lot of people were afraid, including, most importantly, the residents that live there. Commissioner Casey spent his entire career before coming and joining me in county government, being a state trooper, almost 30 years. So, Commissioner Casey, you want to wrap it up on that?
Yeah, I would just say, look, we're all in this together. Please, please, please listen to your local leaders. There'll be a time to hash things out later. The first responders, as the same as your medical workers, they are getting their butts kicked every day. I mean, this is really taxing our public safety community, especially our medical providers. I will say that you have every reason to be extremely proud of your Orange County workforce. I deal with all the department heads every day, and everyone's pitching in, from aging with the meals, Anne-Marie, Gross with the human resources issues, Valley View, the Sheriff's Department. Could not be more proud of your county workforce, really getting it done out there every single day. And the other thing I'd like to say is your medical providers, your nurses and docs, they are warriors. Just out there every day.
We are very proud of the people we work with, and in about 3 minutes, so it's now 3 minutes is 7 p.m. We do a call every night with every county executive in New York State, as well as Mayor de Blasio's office in New York City. And I will tell you, it's not like that in every other community in New York State. We have, like Commissioner Casey said, DMV, Department of Motor Vehicles. Those staff have volunteered to be cross-trained here so they can answer those emergency calls. And there are people throughout our community doing great things that are making us proud. So although we're in a tough time right now and we're reaching the peak, as everybody's talking about, a lot of people ill. Many people are also hospitalized. Some people are passing away. We also see a light at the end of the tunnel, and we also see great examples of our fellow neighbors doing outstanding stuff that you should be proud of. If you want to be one of those people, we need you. Call this 1-800 number that we have on our website. Call one of your neighbors. Call somebody you haven't talked to in a while to see how they're doing. If you don't check on your parents or your kids, check on them now. This is a great time to show what we're really made of. Dr. Gelman, any final comments?
I would leave you with this final thought. As we are releasing new numbers, please consider the fact that this is community-acquired transmission. Those numbers are reflective of actual individuals who tested positive, who are currently under mandatory isolation in their homes. What you should really be concerned with are those individuals that are still out and about, still congregating, like Commissioner Casey has mentioned, because those are the individuals with the potential to transmit this disease. Those are your vectors. That's the potential to really transmit the disease and for the potential for exposure. And the single most effective means of really protecting yourself and others still remains staying at home. Just staying at home, and that really gives you all of the control that you need not to be infected.
Thank you for listening, folks. We're going to continue to update you as we have relevant information for you. Keep doing a great job, making us proud, and we'll be back soon. Thank you very much. OrangeCountyGov.com for everything that we've talked about tonight. If we missed something, send us a message. We'll get you an answer. Good night.